A very good morning to all the members of our LAX2049. I've got news for you, group number 170. So it's glad to see all of you back for our group discussion number 3. Before we begin with our discussion, let me introduce myself. My name is Yavinash Naidu Saravanakumar and my matrix number is 198543. Nava?
Hello guys, my name is Navanitha Krishna Chandran. My matrix number is 198741.
Nemo?
Hi everyone, my name is Yamudan Selvanathan. My matrix number is 199091.
Nur Emilia?
My name is Nur Emilia binti Kamaruddin and my matrix number is 187497.
Ravindran?
Hi, my name is Pravindran, son of Govindraju, and my matrix number is 196677.
Pong Wan Bin?
My name is Pong Wan Bin. My matrix number is 206401.
Witness?
Hello everyone, my name is Vikneswan Devendran and my metric number is 197279.
Hi everyone, my name is Arvind Sanosegaran and my metric number is 196432.
Okay, thank you very much everybody for the introduction. I hope you all are doing well. Well, today we will begin with our group discussion number 3 where we will be discussing articles regarding the theme of health and lifestyle. So I would like to begin with charming Pravindran. Please share with us your article and explain to us what is your findings about. Go ahead.
Okay. Wow. Wait for a while. Now, the host disabled participant screen sharing.
Sorry. Okay, sorry.
Can I share my screen?
Sorry.
Okay, can you see the article?
Of course.
The news section.
Yes.
So my news that I have taken from Medical News Today. So it has been posted April 1, 2019 by someone, Natalie Butler something. Okay. So what happens when you eat fast food? Okay. The term fast food generally refers to that people intend to consume quickly, either on or off. There's plenty of well-researched evidence demonstrating the various negative health effects of eating and overeating fast food in both short and long term. So this news is generally about the disadvantages of fast food. So let us see what will happen to us if we eat fast food in short term. So because of fast food typically high in sugar, salt and saturated or trans fats, looking at the short-term effect, these nutrients can help determine what happens in short term when a person eats fast food. Okay. So the result from the nutrition research practices suggest that eating fast food more sugars as the first meal of the day could make person feel hungrier at their next meal if they ate a low sugar meal. So basically, it's all about the sugar intake of fast food, which will make us feel hungrier. Next, about the dietitian, what they say. So it's all about the disadvantages. There are many disadvantages in here. So next, we will go to the long-term impact, what will happen to us. So there's plenty of well-researched evidence showing that regularly eating fast food can harm a person's health. This is because more fast food is high in sugar, salt, saturated fat, same as the short-term impact. But also processed ingredients and calories and low antioxidants, fiber, and many other nutrients. Many fast food meals are very low in fiber. A low in fiber diet is associated with a higher risk of digestive conditions such as constipation and diverticular disease, as well as reduction in healthy gut bacteria. So this is more to the long-term impact. So there are many long-term impact. I will share this link in the chat room and you all can also read it. So next, the summary of this article, the total news is, fast food tend to be high in salt, sugar, saturated fats, trans fats, calories, and processed preservatives and ingredients. A lot of well-conducted research has been proven with negative health effects of consuming too much of this. Not all fast food is bad. However, some menu items might be lower in the substance, others. While some of the fast food outlets might focus on providing more healthful options. So basically, that's all about the news. It's about the disadvantages of fast food. Yeah, thank you very much. We can move to our next friend.
Okay, thank you very much, Ravindran, for that great article that informs us about the problems that we face when we consume a lot of fast food. And next, I would like to ask Navanitha Krishna to present on his article. Thank you.
Thank you, Yanas Naidu. Let me share my screen. You guys can see? Right.
Yeah.
Okay.
Yes.
So this article is mainly about the second person who cured from HIV. As we all know, HIV is one of the uncurable disease that is transmitted throughout the world. Just like coronavirus that we have, the pandemic COVID-19 that we are facing now, once HIV was considered a serious pandemic, where millions of people died. So these articles is created by Michelle Roberts, and I took this article from BBC News. So in this article, they stated that a man from London has become the second person in the world who cured of HIV. And still many people in the world think that HIV is uncurable, but in the actual case, it is still curable, and it is proven where the second man in the world is cured from HIV. So here they stated that he was now cured by the HIV drugs, where the HIV drugs usually given by the doctors just to make the HIV the disease to be in control in the person. But here they have tried a new method where they call it as a stem cell treatment, where they can introduce a newborn cell to the infected part of the person, where the newborn cell can actually can form into any type of cell which is damaged where any form of cell which can repair the damaged part of the person. So here through the stem cell treatment, finally cured the second person where he was still free of the virus more than 30 months after stopping the antiretroviral therapy. So this is considered a huge success for humankind, where they have finally discovered a way to treat HIV patients. So that's all from me. I'll also share link in the chat box. You can later see that, read the article. Thank you.
Okay, thank you very much, Navanitha Krishna. That was a great article on HIV. So next, I'd like to ask Yamunan to present his article.
Okay, let me just share my screen. Can you all see?
Yes.
Yep.
Okay, thank you, Avinash. So today I would like to talk about the second biggest worry of our nation next to COVID-19, which is the dengue cases. So as you can see the title of this article, like the rising number of COVID-19 infections, dengue cases are also rising in our country. So as you can see here, there's data where Malaysia health officials report 38,240 dengue fever cases, including 60 deaths. with Selangor State accounting for more than 23,000 cases, followed by Johor and Kuala Lumpur. And in the previous year, 2019, our country has reported more than 80,000 cases and 147 deaths. So this is also an issue that our country should not take very lightly, because since now everyone's busy fighting COVID-19, we are starting to forget how dangerous dengue is, because before this, dengue is one of the most deadliest, how to say, outbreak in our country before this COVID-19 took over. So for those who don't know, some of the symptoms of dengue cases include sudden high fever coming in separate waves, meaning first few days you might have the fever, and then the next few days you might not, and then the fever might come back after another 3 days. So that's the meaning of coming in separate waves. And then you might have pain behind the eyes, or your muscles, joint and bone pain, severe headache, and a skin rash with red spots. So there is no antiviral treatment available for dengue yet, and this dengue, it usually targets the platelets in our body, where the number of platelet count decreases by time. And some of the preventions that we can take is we have to use mosquito repellents, containing 20% to 30% DEET, the chemical required to repel the mosquitoes, and we should apply according to the manufacturer directions. And besides that, we can also wear neutral colored clothing, because there are statistics and facts that says that there are certain colors that might attract the mosquitoes. So it is better if you can wear natural or neutral colored clothes such as beige, light gray, etc. It is also better if you can wear long sleeved shirts, because it will protect you or prevent you from the mosquito bites. And besides that, you can also, if available, you can also pre-soak or spray outer layer clothing and gear with permethrin. It's a type of chemical which repels mosquitoes, Aedes mosquitoes especially, the carrier of dengue viruses. And besides that, you can also get rid of water containers around dwellings and ensure that door and window screens work properly. This is especially in your houses where you might find any water containers containing water, clean water, which is stagnant water. The mosquito prefers only stagnant water where it lays the eggs. And there are also numerous measures that has been taken by our Ministry of Health, where they do fogging around the areas where there are a lot of dengue cases, and they also have regular regular checks around the surroundings, where they come and check the houses for any containers containing water, any possible larvae, the larvae, the mosquito larvae. Yeah, so that's it from me. Thank you. Nash.
Okay, thank you very much, Munan, about the article on dengue. As we know that COVID-19 is also on the rise. At the same time, dengue is also something that we need to pay attention to, because it's also here for a very long time and still yet to find a cure for dengue. So I think we will move on to Arvind Bro for him to present on his article.
Okay, let me share my screen. Okay, everyone can see, right?
Yeah.
Okay, so my topic is going to be about diabetes. Okay, apart from COVID-19, diabetes is also a type of chronic disease which has been a health issue for many years. The number of people with diabetes is increasing. In 2000, there were 151 million people with diabetes worldwide, and the number is expected to reach it's about 552 million by people by 2030. So according to a health body, 1 in 5 adults above 18 years old were suffering from diabetes. Actually, this diabetes was one of the 10 major cause of death in 2018. It is a chronic disease that can be prevented by practicing a healthy lifestyle and eating nutrition. It's like just add green vegetables in your meals, and do not take excessive consumption of sugar, salt, and meat. Okay. And then apart from that, people with obesity is easily can be affected by diabetes. And then one more thing is lack of exercise. Just practice 30 minutes or minimum 30 minutes to your exercise. Just spend 30 minutes to do your exercise, and then just maintain 8 hours of sleep. Okay. So people who think that they might not be affected by diabetes, just go for a medical checkup and make sure they are not affected, because treating this disease in an earlier stage is better and advisable than worrying at a last stage. So that's all. Thank you.
Okay, thank you, Arvind bro, for that informative article regarding diabetes. Next, I would like to ask Noor Emilia to present on her article. Noor Emilia, you're good to go?
Yes. Okay, this is my article. So the title of the article is WHO recommends against using remdesivir to treat COVID-19. This article by Jacqueline Howard, the reporter from CNN. So from this article is the World Health Organization has updated its ongoing guidance on COVID-19 administration from US approval, but do not receive approval from the World Health Organization. So because this drug is so expensive and WHO are not in WHO recommendation because they have to have many studies to show the benefits against COVID-19. So WHO have not gained any benefit from this antiviral drug. That's why they do not approve this antiviral drug. But US FDA has using this drug to test on hospitalized patients. And next is WHO convenes an international panel of 24 experts to review this antiviral data and make recommendations. But the recommendation against the antiviral drug. So the summary is one of the researchers say that remdesivir is an expensive drug that must be given intravenously for 5 to 10 days. So this recommendation will save money and other healthcare resources. If this drug is being sold in the pharmacy, they must discuss the price because not many humans in this world can afford this antiviral drug. That's all from me.
Okay, thank you very much, Noor Emilia. Okay, I would like to share the screen so that our member Pong Wan Bin because she was facing some technical difficulties just now. I would like to share the screen so that she can present her article now. Pong, you can start to
Okay.
present. See the article?
Okay, thanks.
You're welcome.
This my article is about the walking. So we can see that many people that like older people, they have bad knees, or they have many people that didn't have time to going exercise or going to gym, so they can choose this exercise to improve their health. Okay, so let's see about the how walking improve our health. So the first is walking can help us to maintain our weight, strengthen our bones and muscle, and also can improve our inhalation or memories. Okay, so a little bit down, please.
Already go down. Can you see now?
Okay. Yeah. So this is the advantage that walking can improve our health. Except of this, if like if we do walking, we didn't have to going outside. We just can walking at home. So I think this is a very good exercise for all of the people that busy walking. So they have don't know they didn't have time to going to the gym, right? So this is my article. Thanks.
Okay, thank you very much. Pong? Okay, next I would like to ask Vignesh to present his article.
Hello.
Ah,
So you can see the article here.
the race for
Okay.
vaccine.
Okay. Thank you, Yavinash Naidu. Today I'm going to present about the rest for the vaccine. As we all know, recently all the newspaper and all the newsletter is coming out with the vaccine success rate. We can see in the recently like 95% success rate. So why is actually steps they're taken by these companies, BioNTech and Pfizer, for their vaccination to produce the vaccine. So we can see here to actually there is to produce the vaccine. The both Pfizer and Moderna vaccine have based on the mRNA RNA. So this one is something that medical industry really approve due to the ethical reason. This is actually to meet all the specific metabolism of all that the human have. So this is actually they're asking why the pharmaceutical company going down to the mRNA route, because it is the fastest way to produce a vaccine according to the industry source. So we can see here it's actually a fastest because you need to pick the 3 core virus and mass produce it. When you inject this into your body, it provokes your immune system to produce antibodies. So this is actually how to say this mRNA is actually the code they use to produce their own antibodies from the human, is to fight out the to fight the disease, or like we can see the COVID-19, because the COVID-19 strains are very kind of dangerous. So this able to fight not only to not to destroy the strain, but is to lessen up the effect of the strain on your body. So this is actually mRNA derived from the cancer patients. Is we can but other than that, is like there are also some of the professor or some of the academician. You can see here emeritus professor Dr. Lam Saikit say it will take a time to produce the vaccine to meet the successful rate. Because it will need a lot of phase, like first stage, second stage, third stage, to test they're going to test with animals and other besides human. Then the second phase they're going to start with small scale of humans, peoples, and so on. Third and the fourth stage. So to after they produce this vaccine, they're going to approve. Then they only can transfer, or they can give this vaccine as an approved vaccine to the other nation or other state for the purpose of breaking the COVID-19 chain. So we all can see what these Pfizer and Moderna companies like make the success rate all over the world are talking about, like they want to this vaccine and going to cure their people in the state. So I think that's all for my article. So thank you.
Okay, thank you very much, Vicky. That was a great article on the vaccine that has been found, presumably found for the COVID-19 virus. So finally, I would like to present my topic. So yeah, I hope you can see my screen.
Yeah.
Okay. So I would like to talk about the potential factors contributing to vaccine hesitancy among parents in Malaysia. So as we all know that as much as it is important to get your child vaccinated, and that much of parents feel that it is not safe for their children to be vaccinated due to a certain stigma where they believe that it is not safe, it could deteriorate the health of their children. So through this article, we can see I've highlighted the main points. If you could see, there is an increasing number of individuals who perceive this unsafe and unnecessary, although vaccination program has been recognized as one of the most successful preventive measures in public health. So as we look in Malaysia, I will go down. Before that, why I say vaccine is very important is for children, especially because of their age. They are very vulnerable to diseases, and diseases these days could kill you at a very short instance. So vaccinating your child is very important because your child might fall ill if it's not vaccinated, or vaccines do a good job for preventing diseases that are intended to be prevented, like dengue, chickenpox, chikungunya, these kinds of this kind of diseases do not have a medication to cure it, but it can be vaccinated to protect yourself from being infected from this kind of disease. And vaccines are safe. Presumably, we can say vaccines are safe and they have a good relationship with their the parent should have a good relationship with their healthcare provider, and of course, the healthcare professionals should explain to the parents on the importance of getting their child vaccinated. And out of the survey that we have done in Malaysia, from around 73 parents, 64 of them acknowledge that immunization appeared to increase significantly after the intervention session was conducted. And in Malaysia, we can see that the low awareness about the benefits of vaccination is because of the availability, the accessibility, the affordability, and the misconception. So a lot of rural area parents are not given the exposure on vaccination because they do not have the communication, social media, and stuff like that. And at the same time, they do not have the economy to support in getting the vaccination. So overall, I would like to say that it is very important that we vaccinate our children because they are the future of this country. And it is like what Noor Emilia and Vignesh said. Mine is they were talking about the vaccines, and I'm just talking about the hesitancy among parents. So why we should allow our children to get vaccinated. So thank you very much, and I would stop sharing the screen. Okay, so I think we had a very, very good discussion regarding our theme of health, where Pravindran talked about fast food, Nava talked about HIV, Yamunan talked about dengue, Fong talked about the benefits of exercising, Arvind Bro talked about the diabetes, and Vicky and Noor Emilia talked about in a wholesome, we can talk about vaccination. So now we have to choose which article which is fits best in our section 2 of our UPM CNN. So I would ask Nava, which would you go for? Please unmute yourself.
Sorry for that. Okay, I think I will go for Yamunan's article, which is about dengue,
Okay.
because COVID-19 is what we are all aware of nowadays. But dengue, because of COVID-19, we forgot about dengue. So I think Yamunan's article is good to be presented, to be taken, and also Avinash, Nash an article which was about awareness among the parents in Malaysia about the vaccination. I think it's a very good article.
Okay.
How
Thank you
about
very
you?
much.
Oh, sorry.
What about Vignesh? Which article do you think is suitable?
For me, I will pick Yavinash Naidu article because it seems like everyone don't know about the vaccination advantage. Because we can see, we take an example in Malaysia, the cases are spiking right now. So I think if we get the advantage, the idea of advantage, the people will know. They will be more aware of this COVID-19 chain.
Thank you.
Yeah, thank you.
Tom, which article would you like to choose? Stay 2 articles only.
I would like to choose dengue and also the big thing. So because I think the dengue is also a very dangerous case in
Other,
Malaysia.
what is the other article? Dengue and?
Dengue and the Yamini you said about it. Yeah.
Okay. Thank you. Okay, I think everybody has predominantly we have agreed that the article on dengue and the hesitancy on vaccination has received a lot of support, saying that we should publish it on our UPM CNN section 2 of our news. So I think we will design the news later, and I will hope to see you all soon on our group discussion 4, where we will be talking about entertainment. And I hope you all get ready with your article so that we can discuss with in our next session. So thank you very much for joining. Have a pleasant day and see all of you all in the next group discussion. Thank you and bye-bye.
Okay, thank you everyone.
Bye bye.